So our last presentation for this afternoon is Overcoming Myths and Barriers Related to Home Dialysis. We have actually three speakers this afternoon. We have Susan Witzel-Kruder. She is a licensed clinical social worker for 35 years. She's been with Physicians Dialysis. She is also involved in the chair of the Council of Nephrology Social Worker for South Florida. Susan's always willing to volunteer to help the NCC, the HSAG Network 7, Emergency Management, and the National Kidney Foundation of Florida. We also have Ashley Thompson. She is a registered nurse that has worked with the end-stage kidney disease community for the past 10 years. She has worked in a variety of roles in all treatment modalities, and currently she is a home hemodialysis nurse in the Pacific Northwest. We also have Ilya Fonseca. She's originally from Cuba and now resides in Miami, Florida. Otilia was diagnosed with kidney disease in 2011 and currently is a peritoneal dialysis patient. Otilia is an ambassador for the Depression and Bipolar Support Alliance, the Florida ESRD Network 7, and a patient subject matter expert for the ESRD NCC NPFE-LAN. So thank you all for being here, and I'm going to turn it over to Susan to kick us off.
Thank you very much. And good afternoon to everyone and welcome. First of all, I'd like to congratulate everyone for being here, because just being a participant in this webinar really helps everyone. It will help you individually, it'll help your peers, and it will help increase your knowledge base. This is a great way to become informed. And I also want to give kudos to everyone who's presenting, the professionals and the patients especially, for sharing their information. In the last session, something really wonderful was said, and it was shared in the chat as well. They said, education is power, and that is absolute truth. It's not only power, but it empowers you. So in this session, what I want to do is share a little bit about some of the barriers to home dialysis and why they happen. Next slide, please. So one question is, why are patients not referred? We all ask that question. First of all, why aren't patients referred early to nephrologists? And then why are the primary doctors and the nephrologists not referring for all modalities as options? Or why aren't the patients being educated about all modalities? This is something that CMS, that Medicare has in the guidelines, that every patient should know about all modalities. But all too often, patients end up in a clinic. So what are the reasons? Sometimes it's because a provider may not want to lose their patient. They develop a rapport, and they feel that they can do the best for that patient in a clinic where they can see them often. Well, should a patient be referred to an alternate treatment option? Absolutely. Patients have the right to know everything about all treatment options. So some people that feel that there might be limitations to the patient's cognitive or physical ability. Well, they might be seeing them at their absolute worst. They might be seeing the patient, the professionals, when the patient is having fluid overload, they have a toxicity level in their blood because they need dialysis, or the patient has waited too long to be seen, or they might be seen for the first time in a hospital. These are times when it's very hard to hear everything that someone's saying to you. And I think it's really important to note, when I first started in my 20s working in dialysis, I have to say that in the first few weeks, I spoke with patients and heard from new patients. I never heard this information before. And over the years, I've noted that sometimes it's because when you are not feeling well, when you're sick, when you're in a hospital, or when you're just being given too much information, we all hear the kids talking about TMI, too much information sometimes puts you in overload. And what I tell people is, have you ever watched the Charlie Brown cartoons with Snoopy? And you see when the teacher is talking and you notice said in the cartoon, they have the teacher saying, wah, 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 because that's all the kids are hearing. Well, sometimes it might be the doctor or the nurse or other professionals speaking at a patient and not realizing that the patient isn't understanding either the medical jargon or too much information that's being thrown to them. Also, a patient might not be financially eligible for some of the home modalities. And when I talk about that, I'm not talking about all modalities, I'm talking about some of them. So what might happen? A patient might be losing insurance because they've stopped work before they reached end-stage renal disease. They might have even applied for disability, but other disabilities can take up to 2 years to get benefits through. And that means they might be without effective insurance. Why else? Well, they might have concerns about costs that would be involved in a home modality, extra water costs or extra electricity costs. So next slide, please. The lack of knowledge is something that's really important. A provider might not be educated on all the different types of home modality that's offered. So if you're a professional, I've heard many people at professional conferences hearing about home dialysis modalities and saying, I've only worked in center, or I don't know about anything that my clinic or my provider offers. It's your own responsibility as a provider, as a professional, to learn that. And I want to say to every patient on this call that it's your imperative to learn everything that you can. And if you are not getting the information from the provider that you're working with, ask questions, contact your network, let them know that you need to know where to find information. Speak with your social worker, your nurse, your facility administrator, and of course, most importantly, as everyone has said, your doctor. If there is a modality from home dialysis that you are interested in, advocate for yourself. There is staff-assisted home dialysis where you have the same kind of machine that's in the clinic. The supplies are brought to your home and a staff member comes to offer that treatment. That's very limited because not all insurances will cover that, but there are insurances, especially some of the Medicare Advantage plans or HMOs, that are happy to cover the cost. You might not have that offering in your area. That's another problem. But then we have peritoneal dialysis that basically can be done anywhere. It's very popular in other countries, in other parts of the world, because it is so easy to go in and be trained in a center for a short period of time and have support these days, especially with telehealth, and have visits to your doctor and phone calls or telehealth with your nurses. It's a wonderful thing. And these days, your machine can be monitored remotely as well. There are also the Next Stage and Tableau machines. And there's another one called, Quanta. Those are self-hemodialysis machines. And those are all things that you can look into and find out if it's right for you. Years ago, they used to say you have to have a partner for home modalities. Speak with your doctor because these days, that's not always the case. So your provider might not know exactly how to address insurance barriers. Even if you're pre-dialysis, even if you're CKD, you can advocate and ask for a social worker or insurance specialist to speak with you about the limits and who you can talk to about your options and choices. They might not be familiar with some of the companies that provide home modalities, but you can advocate and ask those questions also from your network. It's really important that you know who your network is and what they can do for you. These patient mentors that spoke a moment ago were wonderful. They can tell you about their experiences. And I know there was one person who was doing peritoneal dialysis that was speaking earlier. They might not be able to address all the specific questions, but they could do a great job of addressing their experience with you to give you more knowledge. Next slide. So one of my pet peeves is the lack of early intervention. We have a lot of patients that have an early start dialysis. And I think that's a lack of education in the community. In part, it's patient denial as well. People know they have a history of hypertension, diabetes, or some people have a family history of renal failure or the other illnesses, and they don't follow up or they don't want to hear what doctors tell them. Sometimes a family member or significant other is not involved during an office appointment. And it's very hard to take in everything that's happening, everything that's being said during appointments. I encourage patients to bring note cards with questions written down that you have already. And you might want to get involved in looking on really good, valid websites like the American Kidney Fund, the National Kidney Foundation, the American Association of Kidney Patients, and your network to get some questions. When you go in, if you have an advocate, a friend, a family member, someone with you, they can take in some of the information that you might not be able to take in, and they can help asking questions. If you tell your provider that it's all right for them to be there with you and to speak with you, or they might remind you of things that were said later on. Another barrier is a language or cultural barrier. Sometimes utilization of translation lines are not always successful. Recently, I used a translation line by phone with a patient who was speaking a particular dialect of Chinese. And though I did ask for their dialect, the translator did say that it didn't appear that they were taking in all the information. Even the family that was here was not able to communicate in English well enough. It's a very hard thing, and you have to be inventive and find other ways to deal with that. Cultural barriers are also important to know about. Some people from certain cultures will not have eye contact with the providers. Sometimes providers think that that means that they're not interested. On the contrary, it might mean that they are very interested and they are showing respect to the provider. Next slide, please. So what other problems are there? For the patient, it's the fear of the unknown. Who will oversee my care? Will I have to give my own medications? And I mean injections. Will I incur any additional bills or costs? Do I have space for all of the equipment and supplies? Maybe they live in a smaller area. What will happen if there's an emergency? What happens if there's a hurricane, a snowstorm if you live in that area, or an earthquake? What will I do? And I'm not sure that my family will accept my treatment at home. These are all great questions, but you don't know answers unless you voice your fears and your opinions. So please share them. Next slide, please. Well, addressing potential added costs, it is possible if you're doing certain home modalities that you would get higher water bills or higher electric bills. And that's something really important to discuss with the social worker, with the provider who's offering the home modality, and find out what the average added cost is, because for some people it might make a difference. Next slide, please. Now I want to talk about some myths. Some people might say that it may make me ineligible for transplant if I'm doing this at home. Absolutely untrue. I won't be able to see my interdisciplinary team, the doctor, the dietitian, the social worker, and the nurse. So it's true you will probably see them more often if you're in a clinic where they round on a regular basis. You can see your providers at will. You can always make appointments with the doctor, with the dietitian, with the social worker, or the nurse, even when you're on home treatment. You can also ask for home visits, and you can do telehealth, which is a wonderful, wonderful thing that the pandemic brought us. Everyone talks about the negatives of the pandemic, but that really helped us a lot. I can't have pets in the house. Well, I am a pet grandma, and I often babysit for my puppy. And I have to tell you, I would not want anyone to tell me that I couldn't have the pet in the house, and we don't tell our patients that they can't have their pets in the home. There are certain instances with certain modalities that we do ask for the area where the treatment is being done, for it to be free of pet hair, certainly while the person is being put on or off the machine. Is there an age limit? Well, that's up to you. I know people who are 50 and act like they're 90, and I know people who are 90 and act like they're 30. If you are capable of participating in a home modality, if you are interested and able to be educated, you are a candidate. I have other comorbidities that may prevent me from qualifying for home dialysis. If you don't ask about them, you will never know. I have to put my own needles or self-connect. That is a truth with certain modalities at home. You absolutely need to handle this yourself or have a partner in some instances. However, peritoneal dialysis has no needles, so if a needle fear is your problem, that's something that's easy to avoid. If it's self-cannulating for self-hemodialysis, that's another story. But you can be trained, and there is a way to overcome needle fear that so many patients are worried about. Next slide, please. Most importantly, you want to look at the benefits of home dialysis. You absolutely have more control of your own life. You have better scheduling for your own lifestyle. Most importantly, you can maximize your quality of life. And isn't that the most important thing for everyone, to have a good quality of life? Your ease of scheduling for other medical appointments, this is a wonderful thing because when you're doing your own treatment, you can adapt it around your medical appointments. You can be more flexible for a better social life. What if you have a church meeting or a special event that you want to attend? If you're on home dialysis, you can speak with your team and adapt your time to work around the schedule. And traveling is very easy if you're a peritoneal dialysis patient. It's also easy for other self-modalities. And very important, for someone who wants to continue working or wants to go back to work, you can actually have a work schedule that will work with your treatment schedule. That's a wonderful thing. Next slide, please. Well, I just want to tell you that not only am I a social worker in dialysis for 35 years, but I'm also a family member from a home dialysis, staff-assisted home hemodialysis patient for many years. And I saw the difference of how that helped my own uncle. It gave him a quality of life that was fantastic. He was in his 80s, and he was able to go to weddings, see grandchildren and great-grandchildren be born, and he enjoyed his life immensely. I'm also the grandma for this cute little puppy that's a rescue who happens to be in kidney failure, unfortunately. And I think that education has helped us keep her going for the past 2.5 years. And I'm very proud of it because it's really empowering to be educated no matter what you need to be educated about. And we had a veterinarian at a vet hospital that had given up on her and told us to take her home. And that was it. And we educated ourselves and went back to the veterinarian and said that we heard there are ways to help her recover and that this might be an acute session of kidney failure, not chronic. And we were able to help her. And she is doing very well. So keep educating yourself. Stay in touch with your peers and with your professionals. And no, don't listen to blogs with negative information. Always be positive. This morning, the session with Felicia Speed was fantastic, talking about being optimistic. And Donna was talking about education being powerful. And I just want to leave you with saying that education is powerful. And I want you to empower yourself to keep learning and knowing more and doing well for yourselves, whether you're a professional or a patient. Share information, speak to others, share your story and your situation with others too, because you never know who's going to be your best advocate or your best support. Next slide.
Thank you, Susan. And we're going to hold the questions till the end. So our next, we'll move on to Ashley for the second part of this.
Thank you so much, Stephanie. Well, first of all, I am following a great presentation by Susan. She really provided some really great information about barriers. Coming from the social worker perspective, you really get a lot of more exposure to some of those barriers than nurses do. So great presentation. I will actually kind of follow up on a few topics that you brought up and just add a little bit more information. So you may be hearing things a little bit twice, but it just helps you kind of ring that information as being true. So I will just start off. So as it has said in the beginning, I am a home hemodialysis nurse, and I am cross-trained in peritoneal dialysis as well. And really my focus is just training new patients onto home hemodialysis and providing education about all different modalities. So I want to start out by talking about the benefits of doing your dialysis at home. So when I say doing your dialysis at home, I'm talking about peritoneal dialysis and home hemodialysis. So one of the top benefits is that there's less stress on the heart. By doing dialysis more frequently, when you're doing in-center hemodialysis, typically patients go 3 days a week. When you're doing your dialysis at home, it's more frequent, usually 4 to 6 days per week. So by doing your dialysis more frequently, it's giving less stress on the heart. You may be experiencing fewer episodes of low blood pressure, and that's because I like to explain in-center dialysis as a roller coaster. You're going to your treatment with this high load of toxins and fluid in your body, and during the 3 to 4 hours that you're at treatment, they are quickly removing all of those from your body. So you're going to the top of a roller coaster and then crashing down. And this is only happening 3 days a week. So it's those really high highs and low lows. Whereas when you're doing it at home, it's more of a wave, like just a very soft, subtle wave. Also, with doing it more frequently, there's an improved post-dialysis recovery time. For anyone on the call that's doing in-center dialysis, you may experience extreme fatigue after treatments. I'll often hear that patients are going home and napping, too tired to cook, too tired to eat. Some even are too tired to drive themselves home. And this may last up to 24 hours after an in-center treatment. With home dialysis, you will see an improved recovery time. Some patients, it's as little as minutes, for some it's hours, but you actually will feel those benefits fairly quickly into the training for a home modality. Another benefit is fewer medications. Typically, patients will find that they're taking less medications for blood pressure and also less phosphorus binders because they're getting that phosphorus removed more frequently during the week, and they're removing fluid more frequently as well during the week. So you're not seeing those high buildups of fluid that can cause that increase in blood pressure. Another benefit is improved sleep quality. So with improved sleep quality, you will really find just that you're sleeping better at night is what I'll commonly hear from patients, even as I'm starting to train them on their new treatment. Some patients say that they do have less issue with restless legs at night, so they're being woken up less frequently, and just an overall reduction of sleep problems. Another benefit is improved appetite. And this happens because you're getting those toxins removed from your body more frequently. So it's replacing more of the kidney function. And so in turn, that can just help improve your appetite. It may be that things taste better. I'll often hear that from patients, that food is just tasting better and therefore they're just craving it more often. Another benefit, of course, more energy. And this really has to do with the improved post-dialysis recovery time. Patients, like I said, instead of going home and needing to take a nap, they explain to me that they're going home and maybe cooking a meal or going home or running errands, doing chores around the house, just those little daily things that were more difficult to do when receiving dialysis in-center. So even though they're doing dialysis more frequently, patients do feel like they have more time being spent, like it's a better quality of time outside of dialysis. So they're getting more things done doing home dialysis than when they were going in-center. Patients often, their in-center treatment days, they say that day is my dialysis day. Even though I'm there for 4 hours, the day is spent getting ready to go to treatment, the travel to treatment, and then the rest of the day recovery from treatment. So you may not see that as much when you're doing home dialysis. And the benefit that people just love is the flexibility of home treatments. Yes, you're doing it more frequently than in-center, being 4 to possibly 6 days a week, but it's typically 4 to 5. Those days and the hours of treatment are very flexible. So you can do it Monday, Tuesday, Thursday, Saturday 1 week, and flex those days the following week based on appointments, based on your life. For travel, you have more flexibility. There is some planning ahead that you need to do with ordering of supplies, making sure that you can get your dialysis machine to where you're traveling to, but you're not having to coordinate with a facility to where you're traveling to. So you still have that flexibility on the days and the times that you're doing your dialysis. Next slide, please. Then just to talk a little bit about what I like to call mythical barriers. So this is what I often hear from patients that are interested in home modalities or just want to learn more about it. And this is where a lot of hesitations can lie. But I just want to explain that there is some truth behind a little bit of it, but they are completely false in other ways. So the first barrier that I'll hear often is pets at home. This may have been something in the past that was shared, or maybe it got started reading something online, but pets at home are absolutely a possibility when you're doing your dialysis at home. The big thing is just not having those pets in the room with you when you're starting treatment, when you're on treatment, or at the end. So it's just that risk of exposure that lack of infection control that can happen with animals in the room when you're doing your treatment. But as long as you're able to remove your animal or pet from the room during treatment, I always say pets are great. Please keep your pets. That does not disclude you from doing a home dialysis. Most of my patients have pets, dogs, cats, any type of pet you can imagine. So that is, like I said, not a barrier. Definitely talk to a home dialysis team if that is a concern of yours. Another barrier that I hear often that's not true is patients or care partners concerned that they don't have any medical experience or medical knowledge, and that makes them nervous going into training. It's not required whatsoever. I've trained many patients, many care partners who have never touched a syringe or needle or anything medical or medication related in their lives, and they have been highly successful in the training. We start at the very, very basics when we start home modality training, and we just build up from there. So we provide all the education that you would ever need to do your dialysis at home and to be successful. And also another barrier that Susan did talk about as well is just that home dialysis is more expensive. And this really comes from the fear that insurance costs are higher for home dialysis, but that's just not true. In terms of what is being billed to insurance, what your co-pays are, your insurance does cover home dialysis as well. It's just looking at the same as for in-center dialysis if the clinic you're going to is covered by your insurance plan. And so it just involves working with your clinic, making sure that your insurance is covered at the clinic where you're getting your training for home dialysis. And I just saw a comment that's a really good point in the chat that during connection is where infections can occur, and that's absolutely true. That's why we say don't have pets in the room. With home hemodialysis, just like in-center, there is a drainage line. And for some reason, the smells and that drainage line is very, very tempting for dogs to chew on. Or for peritoneal dialysis, the line that connects to the peritoneal dialysis catheter is also can be very warm and tempting for animals to chew on. So that's just why they say no pets in the room, but like I said, you can still have pets at home, just outside of the room. Next slide, please. So some other barriers at home to doing your dialysis at home. There are some ways to overcome these. And so I'm just going to go through each and talk about some more information about them. The one barrier to doing home that I hear from a lot of patients is that they feel poorly during or after in-center dialysis treatment. And so their concern being, how am I going to go through training if I feel this poorly before, after, during? And so the part of that is with doing your dialysis more frequently, you may not be experiencing those negative side effects that you may be experiencing in center. With taking fluid off more frequently, you'll find that you may experience less cramping doing your treatment at home. You may experience less episodes of low blood pressure. So overall, home modalities are much gentler on the heart, on the kidneys, on your body. And so you may find that you're having more energy and able to learn and just think more clearly, getting your dialysis more frequently. And so just something to think about, that learning and doing your dialysis more frequently may be a little bit easier than you think it might be. I always encourage patients to start training if they're interested in home and they've been cleared by their doctor and the nurses, and just to see how you feel at the start of training. As you're going through it, you'll start to see that improvement within a week, maybe 2 weeks, and then just really going from there. And also, some modalities, you have that care partner. And so kind of partnering with your care partner and being a team and just taking it a day at a time. Another barrier that a lot of patients express is fear of cannulation. And I understand this. I as well have a fear of needles. And doing your dialysis even 3 days a week can seem terrifying, especially the newer you are to the modality. But we do have some really great training tools in place that can help overcome fear of cannulation. So one thing is baby steps to learning how to put your needles in. And when I say put your needles in, some patients put their own needles in, and that's what we call self-cannulation. But a lot of patients have a care partner, and the care partner is the one that's responsible for putting in the needles. So kind of deciding beforehand if you're interested in home hemodialysis and doing that training, if you yourself are able to do it, or if your care partner is the one who'll be learning how to do it. And baby steps to learning how to putting your needles in just starts with very small exposure to the process, especially if you have that fear. So it may just be one day watching the technician or the nurse cleaning your access before putting in the needles, or looking at the needles themselves. You don't even need to watch it being put into your arm at first, just looking at it beforehand. The great thing, once you're able to get to the point of putting in your own needles or having someone who is consistently being the person to put in your needles, patients always say that they experience less pain and fewer complications when it's more consistent about who's putting in that needle. You get very, very familiar with location of where to put those needles. You're not having maybe turnover of staff or someone new that hasn't stuck your access before. And for patients that are able to put in their own needles, you do have some feeling in terms of the proper placement of the needle. So beyond just familiarity of where to put your needle, you can often prevent things like an infiltration because you do have some feeling as to if the needle is in the correct placement or not. So patients that do home and do their own self-cannulation, if for some reason they need to get treatment in center, say their care partner is sick or they're traveling and they just want to go to a clinic in center, they still opt to put their own needles in because they know what to expect. There's no element of surprise with someone else putting in their needles. So they start to feel so much more comfortable and confident in putting in their own needles. So they don't have that fear anymore going to the clinic. And so even if you're thinking about home hemodialysis, and this is that barrier for you, that fear of cannulation, I recommend seeing if you can talk to one of the home nurses. And there may not be one at the clinic where you're attending, but you can maybe get connected to one at another clinic and talk this out with them and maybe talk about some baby steps that you could take while you're getting treatment in center to get a little bit more exposure to the process and see if it's something that you might be motivated to work towards overcoming that fear. Another barrier to home that a lot of patients may experience is just limited storage. So with home dialysis comes that need for storage of supplies. Particularly peritoneal dialysis, there are a lot of boxes that you need storage for. And with home hemodialysis, it's typically about the space of a closet. But I have a lot of patients where I am a nurse in the Pacific Northwest, in the greater Portland, Oregon area that are living in one-bedroom apartments. And so there are some ways to get very creative about where to store all of your supplies. Some in a closet. I've seen some great storage options for underneath of a bed. So there are some really great options if this is one of your issues or barriers that's holding you back from doing your treatment at home. Also, for limited storage, if still that is an issue, even if you're trying to be creative with your supplies, you can look at getting your supplies shipped more frequently than just once a month. Another barrier is no care partner. So with all home modalities, you don't necessarily need a care partner. For peritoneal dialysis, if you are physically able to do what is required for the treatment, you may not need a care partner at all. You can do 100% of that treatment at home on your own. And the nurse that trains for peritoneal dialysis will make sure that you're comfortable and confident before you're going home and doing it on your own. So know that that's not an absolute barrier to doing home modality. With home hemodialysis, most of the patients do have a care partner, but it's not always required. It is up to your doctor and nurse and what you are physically able to do. You know, some patients can treat at home without a care partner for home hemodialysis, but most either don't want to or aren't able to, and that's okay. And that is far more common than being able to do it at home. So I've had some patients be really creative about who their care partner is. Yes, that person does need to be consistent, but it doesn't necessarily have to be, say, your significant other. I've had patients who their care partner ends up being their roommate or family member or even a friend. So just kind of sometimes thinking outside of the box who your care partner may be. Or talking to your home clinic or even a social worker, maybe brainstorming if there is anyone in your life that might be a good consistent care partner for you. And if not, that's okay. You can still look to see if peritoneal dialysis is a possibility for you. Another barrier is weakness or limited mobility, either being in a wheelchair, having arthritis and limited mobility, fine motor skills of your hands can make home dialysis very challenging. And that's where a care partner can come in. I have patients that range from being in their 20s to their 90s, and their care partners are the same. Some care partners are very young, some care partners are in their 80s. And so as long as you can have that team of yourself as the patient and a care partner, if both of you can do little things, you can work as a team and get that job done. So this is not necessarily a barrier to home if you have a care partner that is physically able to help with the dialysis. I've had patients who were bedbound, bedridden, that could physically not sit in a chair or even in a wheelchair, and their care partners were able to perform the treatment for them. So I think it's just important to know that's not necessarily a barrier. And age, absolutely not a barrier whatsoever. Next slide, please. And that's all that I have for now. Thank you so much for letting me speak today.
Thank you, Ashley. So our next portion of this is Otilia. Otilia, is your line unmuted now?
Can you hear me?
Yes, Otilia, hi. Great. So
Hi.
we have some questions for Otilia. Otilia, once you were diagnosed with ESRD, how did you find out about home dialysis?
Well, as soon as I had the kidney problem And as soon as I started being treated by my nephrologist, as I was being treated by my nephrologist, I was not aware of home dialysis. Not throughout the time that I was treated for about 4 years before I started dialysis. However, what happened was my nephrologist sent me to the cardiovascular surgeon to get a shunt. And I had a shunt, and I had a fistula, and neither one of them worked. I was not able to get anything from there. So when they noticed that they had to go to my right arm, and that was not such a good arm either, my doctor decided that the best option would have been home dialysis, peritoneal dialysis. That's how I came about it. By de facto, I don't know how to say it, by need, not, it was not planned. It was a matter of, you have to do it. That's how it happened.
And how many years now have you been on home dialysis?
I've been in home dialysis for 8 years.
Right.
And I keep on going.
Do you feel a physical difference between doing home dialysis as opposed to when you were in center?
Well, I was not ever in center. Hemo, I never did hemo. So I can only tell you that with peritoneal dialysis, I have no problem in dealing with my daily life. I have stamina. At the beginning, I used to work, and my life continues to be more or less like it has always been, with some deviation, a little bit. So it doesn't impair me in any way. But I cannot compare it to hemo because I never had hemo.
Right. Well, are there stressors in doing a home modality?
The one stressor that I have found is when I'm tired. At times, I overdo daily routines, or I do too much, and I'm tired at night. Sometimes, not too often, but sometimes. And when I'm tired, I feel like, oh my God, I have to now hook up the machine. But that doesn't preclude me from doing it, because my thinking and my motivation is to keep alive, to keep on going, and that machine has to be properly done so that I can continue to live. So it's a big motivation, being able to continue to live. But yes, sometimes I'm a little tired, and it's a little bit of a stress to have to put it on.
Right. So how do you balance your dialysis and the rest of your life? Meaning, how do you work your dialysis into your life rather than allowing it to focus on you?
I would say that my success in what I'm doing is mainly by having a routine that I've set up. Sometimes it's even sometimes the routine is something that I might be not flexible about, but I try to be flexible. My routine would be I get up at 8 o'clock in the morning, and I go to bed at 10 o'clock at night. Most of the time, that's my routine. During the day, once I get up and get a shower and have breakfast, I go about doing different things. I'm able to engage, like in my homeowners association, where I am the vice president, and I do letters, and I do bids. I have people bidding for work. I pick up my gray nieces from school many times in the afternoon. I work by helping my aunt, which is 88, in paperwork or medicines or doctors. And I also have a social life. I talk to people, and I go to the theater, I go to the movies, and always trying to fit in the schedule. And if I cannot, and let's say I'm going to a concert, and the concert is going to make me go home at 11, then I prepare my food in the morning in a little cooler so that I can be hooked up until 10 o'clock in the morning. So you have to adapt to the situation, not look at it as a barrier, but look at it as a possibility. That's what I usually do. And I do a lot of things. I go to Silver Sneakers. I go twice a week to Silver Sneakers and keep on going.
Great. Good. Sounds wonderful. Sounds like you're very busy. So that's awesome. So, Otelia, being a home patient, what would you say to an in-center patient, maybe to motivate them to consider a home dialyzing at home?
The very first thing I will tell them is you have more time to yourself, to work, to play, to do anything you want. Time is number one. You have much more time. You have less restrictions. Not a lot of less, but less. Less. Let's just say less. In water and in food. More of a variety of food. It is better for your heart. I've been told that it's much better for the heart to be on PD dialysis than to be in hemodialysis. And you don't have to go to the center every other day or every 3 days. I go to the center once a week or once every 2 weeks. And that's it. Maybe for an hour, maybe for half an hour. I don't have to be there more than that. Then you have more stamina. I'm sure that I talk to people who are hemo, and they do have to rest once they have had the hemo. My day usually is a normal day, and I do sometimes have to rest. I would not say that I don't, but not as often and not as long as somebody who is in hemo. Mm-hmm. I can rest for less often and less time. And those are my main observations. I can travel. That's another one. I can travel with no major problem. You have to plan for it. I've traveled. I go to Jersey and New York every year or every other year, not after the pandemic, but I've been going. I even went on a cruise for a weekend. So you can cruise. So there are a lot of things that are good or better. Good or better.
Right. Otelia, one last question here. How did your family or caregiver adjust to you starting to a home modality?
That's a good question. I am my own caregiver. I live alone, and there is no one in the family that's keeping up with my dialysis. And as a matter of fact, when I was offered home dialysis, especially PD, I went to the doctor that day with my aunt, which happens to be the closest in age. Everybody else is much younger. And she didn't want me to do that. She told the doctor, no, she cannot do that. And he says, why? She says, because she's bipolar. And I'm afraid that she's not going to be able to do it. And then he asked me, would you do it? I said, of course I would. And that didn't preclude me from having been able to do it. So I would say that a caregiver is not essential. You can do it even if you don't have a caregiver. You just have to plan. You just have to, of course, the bipolar is under control. If you don't have it under control and you have a big depression, then you don't want to get up, and then you kind of put a machine on. But my bipolar is right now under control. I'm on remission. But my voice to others is, do not worry if you don't have a caregiver. You can do it. You can do it. And if you do, I'm sure that the caregiver can be given some hints by the social worker, by the doctor, and by yourself.
Great. Well, thank you very much. That was really good. Thank you for sharing your story, Otilia. You certainly are a home dialysis champion. You exude it. You really talk, I know you talk to patients about it and others. So thank you for everything you do. And I do want to thank Susan and Ashley for their presentation also this afternoon. Really great information. So happy you could be here and be here today to present at this summit.